Okay, we will.
Yes.
We will. We appreciate you. Thank you, Koichi, very much. Can you see the castle?
Yeah.
Yeah, there it
Yeah.
is. Okay. We're good. All right, who goes first?
So you say, you always say ladies first. So.
Yeah, I'm sorry, Mai, but she's ready. I'm sure she's ready. She's very prepared.
Okay. So I'll do first.
Go ahead.
Can you see my screen?
Yes, we can.
Okay.
Where did you get this graphic? Liver transplantation. That's beautiful.
You can get this graphic very easily.
Is it just Google search? Yeah.
It's
I love it.
Canva.
Mhm.
What? I'm sorry?
Canva.
Canva. Oh, like
Yes.
canvas.
Yes, this app.
Okay. Do you pay for that?
Yes.
How much do you pay for Canva?
About 1,000
1,000
per month.
a month.
I don't
Interesting.
really know.
Okay, yeah, I'm so cheap. I just use Google search and then it ends up with the Alamy logo all over the picture. But thank you for this wonderful graphic
Yes,
that you paid for.
this graphics doesn't have copyright.
You've paid. I'm a
actually-
kachimbo. I don't pay. So you
Me
pay.
either.
What? Taki, you don't. Yotaro, you don't pay.
Yeah, I'd like to use the Canva because AI using Canva with AI is very useful. I heard so.
Well,
I want to
Mai
use
is first class. She's giving us a first class presentation here. Thank you.
Mhm.
Okay, go ahead, Mai. Sorry to interrupt you.
No, it's okay. Today I'm going to talk
Mai,
about...
please tip your camera down just a little bit. There you go. A little more.
Is
A little
it?
more.
A little more? Okay.
Okay, that's better. Yeah, go ahead.
Okay, I'm going to talk about liver transplantation that I observed last week.
Tip your camera down just a little more, please. It should almost touch your head. The top of the screen should almost touch your head, but not touch. We don't want to cut your neck off at the bottom.
Okay.
Yeah, Mariko's perfect.
Okay.
Mariko's got perfect framing. It should be like a passport photo. Okay, go ahead, Mai. Thank you.
Yes. Liver transplantation is divided into two types.
Mm-hmm.
DDLT, this is donor liver transplantation, and LDLT, living donor liver transplantation.
Oh my goodness. Okay.
The surgery I observed this type was LDLT from
A living donor.
Yes, from a husband to his wife.
So the living donor only donates part of their liver. Is that correct?
Sorry?
The living donor only donates part of the liver.
Yes.
They would not donate the entire liver.
No, not entire.
But the deceased donor transplants would be the entire liver.
I guess so.
I would imagine so. We can assume that. Okay.
Yeah, I assume that.
Yeah, okay.
And smoking cessation is required for both, for recipients.
For recipients.
Yes.
Okay, but it doesn't say for the donor.
Donor, of course.
What do you mean? Maybe the person died of smoking, and of course they did stop because they're dead. With the DDLT, of course they stopped smoking because they're not alive anymore. Right? I'm sorry, that's the obvious.
Yeah, so
But it says for the recipient, and that's very interesting.
okay.
Maybe we
So-
can talk about that later.
Okay.
Yeah, okay.
Because smoking increases the risk of liver cirrhosis after liver transplantation.
Interesting.
So
Cirrhosis.
cirrhosis. Okay.
Cirrhosis. Yes, thank you.
Cirrhosis. Regarding the clinical background of the patients,
Mm.
she had decompensated cirrhosis and HCC.
Can you explain the decompensated cirrhosis?
Cirrhosis is the final type of liver cirrhosis.
Oh,
So-
so it was basically unrecoverable. That's
No,
why she
that-
needed the
no, it's-
transplant.
Yeah.
Okay.
So for decompensated liver cirrhosis,
Uh-huh.
liver transplantation is the only curative treatment.
Yeah, the only alternative. Okay.
And in this procedure,
Mm-hmm.
the recipient's entire liver was first removed,
Okay.
while the donor underwent left lobe resection at the same time.
Interesting.
And the donor's left lobe
Mm.
was then transplanted into recipient.
Okay.
And interestingly, the liver can regenerate to its full volume as long as more than 30% of the liver remains.
Interesting. So the left lobe, how much percent of the liver is the left lobe?
It depends on person, but about this donor,
Yes.
left lobe is 38%.
So less than 50% of the donor's liver was donated.
Yes.
Okay.
So and left lobe transplantation is better than right lobe.
Is that because the anatomy of the gallbladder?
Yes.
Yes, thank you.
But it's better to transplant left lobe than right lobe.
Now you say that the
Yeah.
donor will be able to, I guess, regrow that left lobe.
Yes.
Will the recipient be able to expand the donated liver in the same fashion? I see. When the recipient's liver was removed, was their gallbladder also removed?
Yes,
Okay.
because it's very difficult to remain gallbladder while doing surgery.
So this recipient will never have a gallbladder from this point on, although they will have liver function.
No, this recipient will no longer have gallbladder.
I understood. Thank you.
So this is the end of my presentation.
Okay, questions? You can unshare your screen now, I think.
Okay,
Yeah, thank you.
thank you.
That's very fascinating. That's a very interesting topic.
So can I ask it?
Go ahead.
So what was the most difficult part of this surgery?
So it's not it's not the only thing for liver transplantation, but
Mhm.
liver has a lot of blood.
Uh-huh.
So the professor says it's always very difficult to do surgery because it always have the risk of
Hemorrhage.
many
Hemorrhage.
hemorrhage. Yes.
Yeah. Yeah, okay. And then stopping the hemorrhage might be also difficult.
Yes.
I guess my question is, in this procedure, you have 2 patients in the operating room. Same operating room? No.
No. But the operating room, but next to.
Okay, so they're separate operating rooms.
Yes.
And then after the removal, the organ is rushed to the recipient.
Yes.
Okay, interesting. When the organ is transferred from the donor to the recipient, is it in like normal temperature conditions? It's not placed on ice or anything like that.
No.
Yeah, okay, because usually in emergency situations, the organ is placed on ice.
Yes.
But in this case, it's just moved over at core temperature, I guess.
No.
Okay, that's very interesting. And then the patients are presumably both under anesthesia.
Mhm.
So although it's 2 separate operating rooms, this is a dual procedure with separate anesthesiologists, separate surgical teams. Who's in charge of the ultimate coordination of both teams? I mean, you have the lead surgeon for this recipient operating room. You have the lead surgeon for the donor in the operating room. But who does one surgeon take precedence over the other surgeon? Is one surgeon the recipient surgeon leading the overall operation, or do you know? Can you explain that a little bit?
I think one person is responsible for donors and the other person is responsible for recipient.
Okay, but then who coordinates the 2?
I think there is no leader, so they do as a group.
Okay, but then again, in the planning stages, there must be some kind of an agreed upon timeline.
Yes. So the person who performed recipient surgery has more responsibility.
Okay, so they have the final determination of the timeline.
Yes.
But then, of course, the other surgical team has to be in agreement. So I imagine there's a pretty intensive meeting beforehand as far as procedures and timeline.
There were intensive meetings and there were so many people in the operating room.
Wow. Amazing. Now, which room were you in? The recipient room or the donor room?
Yes.
What?
I was in the recipient room.
Okay. Did you ever move over to the donor room? No. You stayed in the recipient OR?
I sometimes moved to donor rooms.
Interesting. Okay. Yotaro, any questions? Oh, Mariko has a question. Mariko, go ahead.
Okay.
How long the recipient will alive after donate the liver?
So I'm sorry. The recipient received her liver. This procedure. When did this procedure happen? When did this
After.
when did this happen, Mai?
2 weeks ago, I guess. I
yes,
guess I
yes, yes.
2
So
weeks
this was
ago, I
2
think.
weeks ago. Are you aware of the recipient's current condition?
Yes.
So what is her prognosis?
She's in a good condition.
Okay.
Yes. She doesn't have any severe symptoms.
What is her age?
59. I
Okay,
guess.
I see.
Mhm.
So is there a prognosis for her? Is it like my understanding is that recipients must use some type of immunosuppressant
Yes, yes.
drugs. Yeah,
Yes.
so that she doesn't reject the non-native liver. Will she
Yes.
need a future transplant after a number of years? Is that normal? I'm not sure.
I have many experience as
Thank you.
emergency physician and intensivist, but I'm very sorry that I don't have experience of treating a liver plantation patient. Yes, so Kansai Medical University. Liver transplantation has not been.
It's not part of your experience.
Yes.
Okay. Now I have heard. I'm sorry, Mariko. I hijacked her question. I have heard that liver transplant recipients will need another transplant within a few years. It's typical. But I'm not sure how common that is, and I'm not sure what the developments are on the immunosuppressant therapies.
I've never heard the patient who received liver will need to
A future transplant.
Yeah.
Well,
I've
if
never
she
heard about that.
rejects that liver for any reason, she'll need another one. And I think that
Yes.
is an occurrence. That rejection can occur. I don't know how common it is, and I don't know what the time period is. So
I think these days less and less patients.
And why
reject
is that, Yotaro? Why is the number of rejections lower now? Is it because the immunosuppressive drugs are better? Okay.
We use a lot of the immune system.
Well, immunosuppressant therapy or immunosuppressant drugs, maybe they're better. They're more targeted. Yeah. It's too bad that her donor was her husband.
Husband.
Well, it's not a blood relative.
Yes, but this time their blood type was the same.
But they're not blood relatives.
Yes, but the teacher says if their blood type is the same, it's totally okay.
Of course, I think blood types must match in a transplant of this type, but it's her husband. Ideally, her identical twin sister would be the ultimate donor. Does that make sense?
Yes.
Yes, but I heard these days, if their blood type are not same, it's okay to transplant the liver.
But if you had an identical twin, that would be the optimal case for a transplant.
Yes, I think
I
so.
don't think she had a twin sister, so
No.
yeah. And then again, a family member, a brother or a child that had the same blood type would also be preferable.
Yes.
The husband, not necessarily.
Hmm.
But asking somebody to give part of your liver is a big. I mean, you wouldn't. If my child said that they were going to give me part of their liver, I would reject that offer. Right? Because you're putting your own child in danger.
Yeah.
Now, a parent donating part of their liver to their child, that would be, if my child needed part of my liver or one of my kidneys, I would gladly donate that. But the other direction is,
Yeah.
you wouldn't want to put your own child at risk.
But I saw 2 patients whose donor was both their child.
Really?
Yes. And the donors are the almost same age of me, so around 22.
I don't want to know those people.
I have a question for Mai.
Yes.
Liver transplantation has a lot of complications, leading death. So regenerative medicine, for example, using iPS cell, is hoped. I hope more than transplantation therapy. Dr. Soyama is working for the regenerative therapy. Do you know?
So, Koichi, you're basically talking about cloning the patient's liver in a laboratory until it's available for the patient, and the patient could receive an identical cloned liver of their healthy liver. How far are we from that kind of accomplishment? This has been discussed for many years, not just livers, but maybe kidneys or even the heart. If not the heart itself, parts of the heart or tissue of the heart. One of my students at Hyundai was using rats and these iPS patches on rat hearts to try to regenerate ischemic or what was it? What is beyond ischemia? Medical terms.
Ischemic heart disease.
But what is beyond ischemia? When the tissue dies. Necrotic. Sorry. Thank you, doctor. So the possibility of some kind of a tissue patch, an iPS patch on heart tissue, that was his research at Hyundai. But that was like 10 years ago. I don't know where the state of the art is now. As far as the liver, I don't know where we are in that research, how far we have proceeded. Dr. Soyama would be a welcome guest in our classroom. Someday, maybe we can invite him to come in. Does he speak English?
Yes. He have worked in Netherlands.
Okay.
For 2 years or 3 years.
Okay. It'd be nice to have him on our program here. Someday, maybe.
Yeah.
Mariko, did that answer your question?
No.
So, what is her prognosis right now?
Sorry?
What is her prognosis?
Prognosis.
Yeah, what is her expected outcome, her expected continued lifespan? Is it good, fair, poor? Is her condition stable, improving?
I think It's good.
A good prognosis, so she can
Yeah.
expect to live a normal life as from here on out.
Yes. She can expect from normal life as
Okay.
long as she doesn't have any rejection of immunology.
That's the critical part there. Okay, Mariko, did that answer your question? What was your question, Mariko? I'm sorry. Mariko wanted to know how many years she's going to live after the transplant.
But I'm not sure how to the transportation, the liver or some how can I say?
Sequela,
Yeah.
after
and,
effects, yeah. Well, evidently, Mai said her prognosis was good and she could expect a normal life, barring any rejection. So if she doesn't reject the donated liver, then
Yeah.
Mai
So
was this.
I-
Go ahead,
I
Yotono.
found-
Go ahead.
So I found the data from Soyamas Plus.
Yes.
It says that if you did liver transplantation,
Mm-hmm.
you can alive 80% for 1 year
Oh.
and 70% for 5 years.
Oh, so there is risk. That's what Mariko wanted to know.
Thank
Yeah.
you. With donate.
No, if you're a recipient, right?
Recipient,
That's the
yeah.
How
recipient.
about the donate?
What about the donor's risk? Do they give the donor's risk?
In my opinion, if there risk in donor, we don't do, I think.
Well, evidently, like Mai said, if you have 30% of your liver remaining, it can
Mhm.
regenerate. So,
Yeah,
okay.
the liver will grow.
And then, of course, as she said, it was less than 50% was donated. Something like 40% was donated. So,
I have never heard that donor will die for the surgery.
You hope not, but any surgery is a risk, especially surgery
Yeah.
where you undergo general anesthesia.
That's
How
true,
old?
but-
How old was the husband, Mai? Sorry,
52.
the wife was 59 and the husband was 52.
Yes.
Wow, interesting. I just have to ask. Sorry, was this patient an alcohol drinker?
Yes.
Suntory should pay for this.
Yeah. Stop drinking.
No, I think the alcohol companies should be taxed for this.
Liver transplant, not only liver transplantation therapy has a lot of problem.
Yeah.
Probably. I don't know.
Well, that's more motivation for this cloning or regenerative research. Hopefully, there are breakthroughs.
If my wife or if my daughter, if my family has a liver cirrhosis, liver failure, I cannot decide give my liver to my family. I cannot.
Especially if they're an alcoholic, you would just be angry. Because if it's a self-inflicted condition, right? Like lifestyle choices, inappropriate lifestyle choices. Like Koichi, I'm so glad Koichi quit smoking.
Probably may destroy the family.
Oh, of course.
Yes.
Yeah. So this is
Very,
a testament to healthy lifestyles. Everyone,
very
Drink.
sensitive problem.
drink in moderation, please. And limit your smoking habits. I'm so glad that Koichi cut back on his smoking. He used to be a heavy smoker, not now. I'm so glad. Take care of yourselves, people. It's the only
Okay.
body you've got, and the original parts are the best. Someday I might need a brain transplant.
Brain.
Yeah, teaching English is very damaging to the brain. I'm joking. I'm joking. I love my job. Any other questions? Mai, that's an excellent presentation.
Thank you, Mai.
And the Q&A was very good too. The Q&A is a very important part of it's the most important part of the presentation. The Q&A. Seriously. Yeah, okay. That's really what we're practicing here. Just to let you know, so many doctors going to congresses and presenting, they have this wonderful PowerPoint presentation. They've practiced and they've even worked on their pronunciation. And then they get to the Q&A and they fall apart. They can't answer the questions.
Uh-huh.
Yeah, so conversational English is very important.
Yeah.
Okay, Gyotaro, I guess it's your turn.
Okay. So just a moment, please. So this week, I went to the
John,
Yes.
I have to leave this Zoom at 6:20.
Okay, go ahead and leave when you need to, Mai. Thank you. I'm glad you went first. Go ahead, Gyotaro.
Okay, I visited a community comprehensive support center.
Okay.
So in the center, they provide integrated support.
Okay. Integrated support?
Support.
Integrated support?
Yeah,
Okay.
every support for older people,
Elderly.
elderly people.
Yeah.
And during the study in comprehensive support center, I noticed that elderly people's BMI is very low.
Low. Yeah.
And I'm interested in the nutrition in elderly people. So I searched about the nutrition in elderly people.
Yeah, and you say in conclusion, we should say Japanese elderly, not older, but elderly. ELDER.
Sorry.
Oh, what happened? How did that happen? Yeah, there you go.
Mm-hmm. I will do it later.
Okay, the edit mode isn't working properly. Yeah, the elderly.
Elderly people.
Okay, good.
So this is one of the paper
Okay.
I found it. It's about the Japanese elderly people, about nutrition of the elderly people.
Yeah.
And the subject was the citizen who live alone.
Okay.
60 to 90.
Yeah.
And the method was the cross-sectional analysis using the database conducted in 2013 and 2014.
So this is a retrospective study.
Mm-hmm.
Okay.
And this graph shows that almost 0% of elderly people, the protein intake is lower than EAR means that.
And the EAR is the 100% line.
No.
What is
this graph shows that if 100%, if elderly people eat estimated EAR.
So the EAR would be 100%, right?
No.
This is change.
Mm-hmm.
Okay. I see. Less than the EAR. I'm reading it now. Thank you. I couldn't see it.
Okay. So most of people don't eat protein.
As their
much
age
protein.
increases, they fall below the EAR as their age increases. Yeah, okay.
Yes,
I see that.
but if we see salt, the most of people take salt.
I see.
And about potassium and calcium.
Huh.
And we can learn from this graph that protein, potassium, and calcium intakes decrease with age. Like this.
Okay.
Not this one, but. And also the prevalence of intake below that EAR is higher in older adults.
Okay.
So, in conclusion, elderly people need to take protein and potassium and calcium, but no more adding salt.
Okay. Questions? Questions?
What do you think is the effective way to reduce salt intake?
Be careful. We're not talking about reducing salt intake. We're talking about increasing potassium intake, increasing. I would say that reducing salt is kind of a, what do I say? Salt has been labeled as the bad guy, when in fact, sugar is probably the worst. A lot of the salt that's available today. Okay, can we go into discussion? Thank you, Dotaro. You don't need to share your screen anymore.
Okay.
I think we understand. Mariko, are you involved with nutrition and patients on a diet? Have you been involved with that? Patients on special diets and that kind of thing?
Oh, sorry, once more, please.
So do you understand AOSHI, what an AOSHI is?
AOSHI.
An AOSHI is the nutritionist in the hospital or in the institution.
Oh.
So, and many patients will be on special diets.
Yeah.
Have you been involved with patients that are on special diets as a nurse? You've never had to work with people and you say, oh, Mr. Johnson, you can't have salt. I want salt on my food. And you're arguing with this old man about the kind of food he wants to eat and how the kind of food that he should eat. You've never had a conflict like this?
Oh no, there are many people, many foreigner, one foreigner.
Yeah.
So last year I experienced the death of the foreign, the very severe case. She had a very severe case.
Uh-huh.
And then so it's very difficult to transfer to the hometown.
So we're talking about the patient's diet and what the patient needs to eat, especially elderly people. Because when a doctor prescribes a special diet, in many cases, elderly people, they just don't want to eat what you tell them to eat.
So could you help me there about I can't understand?
That's okay. We'll just continue. We'll just keep going with that. Go ahead, Koichi.
I help for Mariko.
Yeah, go ahead.
Ryotaro says diet in elderly people reduce the chronic disease, heart failure or renal failure. But as an emergency physician, in my working, I put the sodium to the patient food. So probably because hyponatremia patients hypokalemia patients. So the treatment of emergency phase differ from daily life.
That's right. I think. Yeah, the report was the database on the just a live food, so differ from the emergency department.
It is kind of a symptom of the medical system. We have so many specialists that are so focused and so specialized on what they do. They don't take nutrition into the mix of treatment. That's a job for the nutrition specialist. When the reality is every doctor needs to consider the patient's overall health, and what the patient is eating is a major part of their continued health, their lifestyle choices, their recovery from illness. So my suggestion is that every doctor and nurse, every healthcare specialist think more seriously about diet, about intake, what the patients are eating and what they need to eat and what they shouldn't be eating, right? So
recently,
go ahead.
Recently, the nutrition becoming bigger and bigger.
Yeah, it's the realization of how important it is. It's an increased realization.
Increased realization.
Yeah.
And I learned some of doctor think seriously about diet.
I think it's back to the specialization again. We have medicine has become so specialized and so focused on the specialists and their specialty that they kind of neglect the general aspect of something like nutrition as an important part. Maybe the nutrition specialist should be a standard part of every treatment. Koichi, I kind of want to know how many of these AOSHs that you have in your hospital. How many nutrition specialists do you have in your hospital?
AOC.
Nutrition specialists, nutritionists. Do you have nutrition specialists in your hospital?
Yes.
Do you have enough nutrition specialists that they can add to every patient's recovery process?
Yes.
Yeah, okay.
But severe patient is a very special case. So
sure.
Common nutrition AIC.
AOSHI.
AOSHI. Okay. Yes. AOSHI. Okay. Common AOSHI doesn't have experience for the very severe intensive care patients.
I think the AOSHs need a supercharge. I think there needs to be some re-education for the nutrition specialists. I think there's a lot of new information. Usually these nutritionists are involved in like the hospital food department, and that's their limit. They're not actually involved in the treatment and care of the patients. So yes, go ahead.
Surgeon give the advice before the surgery.
Yeah, like how many years before the surgery? 20 years before the surgery? If the surgeon had great nutrition advice 10, 20 years before their surgery, they wouldn't need the surgery. Do you see my point? Yeah. Like the lady that was drinking too much alcohol, she wouldn't have needed that liver transplant if she just cut back her alcohol consumption. Right? But, we can't go back in time.
Nutrition in acute phase is very difficult. It is very difficult to decide the appropriate nutrition for the patient. Overfeeding, no. Less feeding,
Yeah,
no.
exactly.
Appropriate feeding is very good, but we cannot decide. We cannot estimate the necessary calorie.
And then this is where we need Kansai Idai to come in, because isn't Dr. Wada and Dr. Maruyama?
Yes.
They're
Dr.
working on
Mariana-
this lipid versus carbohydrate balance for recovery. They're working on is it a retrospective study they're doing? That's where we need them to tell us. Yotaro, if you're not familiar, Kansai Idai has a research project where they're looking at
Mhm.
the balance between calories in the form of carbohydrates versus calories in the form of lipids and how that influences recovery. And they have a whole paper on this. When do they present this research? I think he's checking that right now. They have a presentation on this now. The prevailing opinions are that lipids are more nutritional than carbohydrates on a calorie for calorie basis, if that makes sense. Does that make sense to you, Ryotaro?
Yes.
Every human has a certain caloric intake necessity to survive. And if your caloric intake is dominated by carbohydrates, it's not as healthy as if your carbohydrate or if your caloric intake is dominated by lipids instead. And this is contrary to opinions that existed, 50 years ago. So anyway. What,
Okay.
Koichi, are you checking Maruyama's research?
Oh,
Oh, okay. I'm just wondering, did they give their presentation yet? Kansai Idai had their lipid versus carbohydrate presentation.
the paper was published.
Published by who?
Yes.
Who published?
Recent days.
Okay.
Probably, yes. We can research the.
I'm very jealous because they didn't ask me for help. They were supposed
Don't
to
be
ask me.
sad.
They were supposed to ask me for help. Hopefully they can join us in the group and talk about it. They've got data.
Maybe Mariko was prepared for the presentation.
Oh, I'm sorry, Mariko. You can begin right now if you're ready.
Okay.
Go ahead, Mariko.
No.
Go ahead. We started 5 minutes late, so we have an extra 10 minutes.
Oh no! So please, I wanted to share the Polina treatment as a nurse.
Do you have a screen to share with us, or do you just want to talk about it?
Yes, but the next time I try.
Okay, I'm sorry about that.
So sorry.
No.
I take too time.
Well,
But next week I cannot join this lesson because the next Thursday is night duty.
okay. So we will see you 2 weeks later?
Yes.
Okay, that's fine. We look forward to
Thank you
that.
very much.
Yeah.
Mm-hmm. And actually, I will go to the Kamigoto Island for the practice.
Oh, so
But
you
I think
you won't be available next Thursday
No,
either?
No, I think I can come here.
Hope so.
Yeah.
Well, you
I
don't
think-
have to come here. You just have to be online.
No. Online.
Is this your computer?
Yes.
So you have the link. Yeah, maybe you can join us from the island. That would be interesting.
Okay.
I hope there's palm trees in the background. I've got mine not really nice. This is $1 million background here. This is not AI. This is real. Koichi's background is so embarrassing. It's like his sleeping spot or something. Is that your bed, Koichi?
Pardon?
Your bed. We can see your bed.
Bed?
You're doing an English lesson from your bed. Is this your
Sorry.
Leo Palace?
Ah,
Where are you? Koichi's in his Leo Palace. This is
I'm my room
yeah.
in
Yeah. It's like a Leo Palace. His desk is under his bed. It's like micro living. It's like space station life. Japanese do very well on the space station. They're used to small places.
Because we don't have much land.
You don't have a lot of space, yeah.
Mm.
But you know, in space there is a lot of space. But anyway,
That's true.
there are a lot of Japanese astronauts. Maybe more
We
than
can see
Russians.
the Osaka Castle in your site.
It's not computer graphics. That's not AI. That's reality.
Oh, I'm very happy to
Hideyoshi
see
was here. Hideyoshi was here.
that. Mm, Good location.
Yeah. And I'm so glad I'm able to join you all.
Thank you.
Koichi, you should really re-invite the Kansai Idai now.
Oh,
You should re-invite them.
but Dr. Wada and Dr. Mariama are very busy.
But they published.
Mm,
Maybe
Maybe they
now
have
they're
another.
okay.
Writing paper every day.
Oh, okay. But they finished. They should have asked me for help. Did they use the AI to help them? Is that what they did?
Oh yes. We can use the AI method.
I'm
for
very
writing a
scared.
paper. Oh.
Because AI makes mistakes. Every week I'm fixing AI mistakes. I'm very busy repairing the AI mistakes. No joke. But I love my job. Mariko, I am so sorry. We hope to see you in 2 weeks' time.
Okay.
Okay.
Thank you.
Good work, everyone. Hey, what happened to Mio?
Mine needs to leave. At
Mine needed
6:20.
to leave, and she left it at 6:20. But what about Mio?
Mio. Maybe today overnight.
Okay, we hope to
He
see
needs
her
to
next
practice
time.
Yeah.
Thank you, everyone.
Thank you.
If you need to message
you very
me,
much.
everybody has the line group, right?
Mhm.
So if you need to message me, don't be shy. Take care. We'll see you next week.
See you next week.
Take care. Thank you.
See
Good night.
Bye.